What should you do if your lower jaw removable denture won't stay in place? I think you're familiar with situations where you're eating or chatting in a lively group of friends, relatives, or acquaintances, and your denture treacherously falls out, making it impossible to relax, enjoy delicious food, and constantly feels like it wants to jump out of your mouth. In this video, I'll honestly explain why your lower denture is loose and won't stay in place, and how you can secure it reliably without spending a lot of money. There are two types of removable dental prostheses: a removable denture for the upper jaw and a removable denture for the lower jaw. On the upper jaw, a removable dental prosthesis usually has very good retention thanks to the so-called reverse valve or suction effect. That is, the design of our upper denture is dome-shaped, which creates this suction effect. The patient literally swallows saliva, creating negative pressure, and the upper denture almost immediately adheres in place. That's why they are called suction dentures, as I mentioned before. It attaches almost instantly and has very good retention. Now, let's talk about the removable dental prosthesis for the lower jaw. So why doesn't it stay in place after all? On the internet, in various videos and comments, there are a lot of heated debates between patients, doctors, and even dental technicians. Some people complain that doctors do poor quality work. Others say that patients just can't accept that it doesn't stay in place. Our removable dental prosthesis for the lower jaw is very different from the prosthesis for the upper jaw. That is, on the upper jaw, it's a very bulky, dome-shaped structure, while on the lower jaw, it's literally shaped like a horseshoe. Very elegant, thin, and it sits directly on our gum, or as we also call it, the alveolar ridge. It is precisely thanks to this alveolar ridge. In other words, this is, once again, the very place where our teeth used to be, or simply put, our gum. How well this alveolar ridge is formed, that is, the place where our dental prosthesis will be fixed, greatly affects the stability of the prosthesis. The more pronounced the ridge, the better the lower jaw prosthesis fits and holds in place. But sometimes it is atrophied and can be completely flat, and in that case, our prosthesis will hardly stay in place at all. In addition, we have a major problem with the mobility of the mucous membrane on the lower jaw. That is, on the lower jaw, the mucosa is mobile. Of course, this is due to the tongue, which is located on the lower jaw. And this mobility of the mucosa, combined with everything else, creates this kind of problem with fixation. Yes, of course, some people say you can use creams, but I want to emphasize, patients who truly know what it's like to have a lower denture that doesn't stay in place will tell you for sure that it's almost impossible to secure it. Various creams, pads, and adhesives are used, which either provide only a temporary solution or don't solve the problem at all. That's why, once again, a lower jaw denture, especially in cases of atrophy or when the alveolar ridge is not well defined, will hardly have any retention. So what options are there for securing a denture on the lower jaw? The first option I would suggest is, of course, to have a follow-up consultation with your prosthodontist, your treating doctor, at the place where your denture was made. In other words, go in and explain the problem again. The doctor will take a look. It might be necessary to reline the denture. Relining is when your existing denture is taken and either some of the acrylic is removed in certain areas, or on the contrary, more acrylic is added, let's say fused or layered on, to adjust the fit. Also, it's possible that while using the denture, it was rubbing somewhere, which caused you pain, and because of that, the denture wasn't staying in place. You were instinctively pushing it out. So first, consultation, a follow-up visit, another consultation with your doctor where the removable dentures were made. Second, using creams. Special creams that are specifically designed for dentures. Creams, gels, adhesives, various pads that help secure the denture. Of course, many patients write that this is only temporary. Sometimes it doesn't even last an hour, but you definitely need to try it. Maybe in your particular case, this will help you. So experiment with fixing creams and gels. The third option is to preserve the teeth in the lower jaw, the ones you still have left. Because for securing our dental prosthesis, this is very important. That is specifically for support. In other words, every tooth in the lower jaw plays an important role as a future support for the dental prosthesis. Since the dental prosthesis will be attached directly to the tooth, let's say, with a hook, or as we call it, a clasp, a hook. And this will prevent our prosthesis from popping out and will stabilize it directly. And the more such teeth you have in your mouth, the better the stabilization will be, and you won't have these problems with, let's say, the prosthesis falling out. Therefore, the third option is to preserve your own teeth, treat them and prepare them. The fourth option is to place an implant. It is possible and often sufficient to place just 2 implants, 2 anchoring implants in the lower jaw. They can have a ball attachment where the lower denture fits onto a ball and socket, or they can use button type fasteners just like on clothing. A button, you snap it in, a receiver and a snap, the denture is held in place. So you can place just 2 implants and simply snap the denture onto them. The only thing is that you'll need to wait a bit in terms of time. So you get 2 implants placed, wait 4 to 6 months, and after 6 months you'll have a dental prosthesis made for you, which you can easily snap on and you won't have any issues with fixation. Usually all patients are afraid of pain and worry. Will it hurt when they drill into the bone? There are also many other less obvious questions that may come up. So if you want to get implants, write to us on WhatsApp using the link in the description. We can help you solve any of your questions without you even leaving your home. And finally, the last option, which is the most common, is a fixed, non-removable construction. This is the all-on-4 or all-on-6 technology. When you have 4 to 6 implants placed and then get a fixed dental prosthesis on the lower jaw, let me emphasize a fixed one, meaning it is screwed directly onto the implants with special screws, your prosthesis will stay in place and look just like your natural teeth.
Why is a fixed prosthesis considered the best option and so commonly used?
Well, first of all, it's because adapting to this kind of prosthesis, which is immediately fixed onto the implants, is definitely much easier, 100%. Secondly, of course, is the fixation. That is, we secure the prosthesis to the implants with screws, and this kind of prosthesis stays in place. We don't have to worry about it coming loose or falling out. Plus, with this prosthesis, you can already chew comfortably. Of course, not immediately after implantation, but after a certain period of time. But I would say these are already quite fully functional teeth.
And what are the real chances that the implants will take and everything will be fine?
In fact, right now, with the current state of modern dentistry, the success rate is 98%. That is 98% or even higher. So the success rate is very high. Plus, before any implantation, I think any reputable modern clinic, we conduct preliminary tests. The patient undergoes them, which allow us to assess the overall condition of the body and predict which implant is needed, because there are patients for whom we simply will not place implants. If, based on certain test results or during the preliminary diagnosis, we see specific problems. So if everything is fine and the patient is suitable for implantation, the success rate is very high. Write in the comments how you personally deal with the problem of a poorly fitting removable dental prosthesis on the lower jaw. I would be very interested to know. Subscribe to the channel, give us a like, and take care of yourselves.